Oh, and it's doing a transcript. That's fun. Okay. So if everybody could go ahead and introduce yourself. I can't watch the transcript. I'm sorry. I have to close this. Like making me a little bit anxious. So if you could go ahead and introduce yourself in the chat, tell us your name in the agency that you work for, or your role within the balance of state. Even if you're just a visitor, that would be great. As I said when we started, I don't know about everybody else. I do know about some of you. It has been a month. Like things have been kind of strange. They've been chaotic. There have been seems like fire after fire to be put out in our space. So I'm hoping everybody can kind of take a break, listen to our presentation, and get some helpful information. So with that, I'm going to turn it over to Christina Dotson, who was on my screen, and now I don't see her. Oh, there you are. Christina, you should be able to share your screen for your presentation.
I think so. Yep.
Perfect. So Christina is going to give us sort of a rapid fire McKinney-Vento 101, everything that you need to know about how to work with your homeless liaisons in your local school district. So Christina, the floor is yours.
Awesome. Okay. Thank you. Thanks for inviting me today. I am going to work on pulling up my little presentation here while I introduce myself. So I am Christina Dotson, go by Christy, so it's fine to call me Christy. And I work up at the New Hampshire Department of Education. One of my main roles is as the McKinney-Vento State Coordinator. And so one of those roles helps me introduce McKinney-Vento across the state, and I was so happy to be introduced or asked to do this presentation. I am going to go into slideshow mode. I won't be able to see chat questions. So as they go along, if anybody could let me know if questions come up in the chat. We can ask questions as it goes.
Christina, I can monitor the chat for you, and we can let you know if questions come up. Perfect.
Thank you. And you guys can see the first slide, okay?
Yep.
Okay, perfect. So McKinney-Vento, this is my introduction. I just wanted to kind of go through it very quickly and touch on the definition, what students' rights are. Transportation is a big issue right now. What our homeless liaisons in the state are required to do by the law, give you some data, and then questions and resources at the end. So McKinney-Vento Homeless Assistance Act helps provide rights and services to children and youth experiencing homelessness. And just if everybody could mute as they come in, I'm getting a little distracted by some of the noises that are coming through. So basically, we try to remove barriers for students accessing their education and provide stable space for education for students who are experiencing so much other change and trauma in their life. And like I said before, to provide these services, all schools are required to designate a homeless liaison, and every single school in our state does have one of those who help students get what they need, transition into school if they need to, and help facilitate a smooth education. The McKinney-Vento definition of homelessness is much broader than HUD's definition. We look at students who are living doubled up. Doubled up is what we call when they're living with a family or relative, or friend due to loss of housing, economic hardship, or similar problems. And this can be a broad range of things, but basically if they have no other place to go and they have to live in somebody else's house, that can be considered McKinney-Vento. Living in motels, hotels, trailer parks, or campgrounds due to lack of alternative or inadequate housing. So this is important. If they're living in the hotel because they have no other place to go, that is McKinney-Vento. We do have campgrounds in New Hampshire, and sometimes it is a choice of a family to live in a campground and then bounce into like maybe an Airbnb for the winter. So it does matter if there is a choice. So it's lack of alternate adequate housing is the big part there. And then we go into living in spaces not meant for human nighttime residence. So cars, parking garages, outside spaces, and then shelters. And then the big one too that we have to think about is substandard housing, which can be, they have a house or they rent an apartment, but it is inadequate for human habitation. So there's a mold infestation, but they don't have any other choices and they have to stay there. Or there's a rodent infestation, same thing. There's not adequate bathroom or kitchen space. Those can be considered McKinney-Vento and receive services. The words fixed, regular, and adequate are really what we use as a filter for when we look at whether the situation is McKinney-Vento or eligible or not. Is it fixed? Not subject to change. The student is going to be going there regularly, every single night, consistently, and then adequate, which is basically what I just said about substandard. It meets physical and psychological needs. So if a student's space is not adequate, it can be affecting their education, and McKinney-Vento can step in to help. So can the student go to the same place every night to sleep in a safe and sufficient space? I like to talk about doubled up a little bit too, because that can get a little tricky. Sometimes people say, well, they moved in with grandma and grandma has 4 bedrooms and, they have plenty of space. But really it's the reason why they're moving in, sharing of housing due to loss of their housing for economic hardship or similar reason. So questions that we think about to determine eligibility are, why did the parties move in together? Was it some sort of crisis or a plan for a mutual benefit? If it's a plan for a mutual benefit, they are deciding, hey, we're really good friends. We want to share a house together and share that rent burden. That's not necessarily McKinney-Vento. So we look at every situation on a case-by-case basis. Think about how permanent is it intended to be, and the big question is, where would that student live if they were not doubled up? If they did not have that particular space to go, where would they be? So I'm going to pause. Are there any questions on that definition of McKinney-Vento homelessness? Doesn't look like it. So once a student is determined McKinney-Vento eligible, then they have certain rights under McKinney-Vento. The first is, FAPE, the free and appropriate public education. A big one is they can enroll in school immediately, even if they don't have documents that are normally required for school enrollment. This can be birth certificates, school records, it can be vaccination proof, that type of thing. We really just want to get the student into school immediately, and then we work on getting the paperwork after the student's in school. On the other hand, some students continue to attend their school of origin, and that educational stability is a big factor in determining educational success for students. So we tend to look at the school of origin as their best interest, and we try to keep them in the school of origin if possible. Sometimes that means transporting the student back and forth, and so they are required to receive that transportation through district cost. One of the other things that they are eligible for, free and reduced lunch. I don't have that on this slide. They are eligible to receive any educational services. This can include extracurricular activities. So we help with sports and music programs and any school type of activity that a student might not be able to participate in due to their living situation and status. We, as McKinney-Vento liaisons, help remove that barrier for them. I just talked about this a little bit. So maintaining school of origin, maintaining stability is a big part of McKinney-Vento. We want them to remain in the school of origin to the extent feasible, as what they know. They have friends. But sometimes that's not possible, and they do have a choice to attend the school in which they are, the enrollment area of where they are living. Sometimes when that happens, they can have a best interest determination meeting with all districts and parties involved to make sure that that is the best interest for the student. Um, Age, length of time it takes to get to the school, time remaining. If it's a senior, usually even if it's a long distance, we work to keep the student in that particular school to finish out their career. Just, dialing in on this, parents do have the right to choose, and if they choose the school of origin, but the districts have a meeting and say maybe this isn't the best interest for the student, the parents can dispute that. And so there is a dispute policy that goes through for the state to make sure that everybody understands what is best, and we are following McKinney-Vento as best possible. I'm running through this pretty quickly, so I want to make sure, I'm just going to pause again to make sure there's no more questions. Okay. Unaccompanied youth, we get some students who are without a parent or guardian. So they're residing somewhere where they don't have a parent or guardian around. Then they would qualify for an unaccompanied youth status. If they are unaccompanied youth and also living in a situation that is under that McKinney-Vento definition, then they would qualify as an unaccompanied youth under McKinney-Vento. District liaisons step in to help these unaccompanied youth navigate and identify them if they're not necessarily reaching out on their own. Again, case by case basis. We enroll the student. If a student shows up at a school and doesn't have their parent or guardian with them and has a situation that is qualifying for McKinney-Vento, enroll the students and then figure out paperwork, situations, all that kind of thing. If a student qualifies for K through 12 education in New Hampshire, they can be considered a McKinney-Vento unaccompanied youth, and that's up through, actually this slide says 21, it's actually 22 in New Hampshire now. And I like to throw the flow chart for when you think a student is unaccompanied, just thinking about what happens if there's, it really comes down to if there is some sort of plan or a choice, they're not considered McKinney-Vento. If there is a certain emergent situation and they have to leave their home for, families evicted, they can't find a house that's all together, so they have to send, the student off to live with an aunt, something like that. That student would be considered McKinney-Vento. But if, say, the family's transferred for work and they want the student to stay in the school district for a sport and they find a friend to have that student live with, that's not McKinney-Vento. So we do think about what's happening and what the situation is. Transportation's really big in McKinney-Vento right now, mostly because we are finding ourselves transporting a lot of students. There's a supply and demand situation happening where we are having a shortage of drivers, and the price for this transportation has gone up exponentially. We are looking at, I'm getting quotes of $600 a day to transport one student, which is financially really tricky for districts. What is in the law, we have to transport students if it is needed between their school of origin and the school district in which they are living. So if they've moved to a temporary house, they're doubled up, hotel, whatever, in a city or town that's outside the district for their school of origin, those two districts work together to provide transportation and split the costs. If the student is still living in their district of origin, that district just, pays for the cost, provides transportation, it's all set. When they're living in another district, that's when we're running into these cost situations. just a little bit more. It's regarding, we provide transportation for any student who needs it, provided for extracurricular activities if that's needed, for after school care if that's needed, and collaboration between all parties involved is really the biggest part of this piece. I wanted to talk a little bit about funds we use for McKinney-Vento and what's available to districts to help provide students what they need. The first one is the biggest one, Title I Part A. Every single district is required to have a homeless set aside every single year in their grant. They must have consultation with their homeless liaison and take into account the needs of the district when setting aside this money. And it can be used to remove barriers for students experiencing homelessness. Common uses are supplies, maybe extra instruction for students. We can pay for homeless liaisons' time through this funding source. The second one, the McKinney-Vento grant. So there is funding for McKinney-Vento itself. New Hampshire's allocation is very small. It's not a big grant. And so we run a competitive grant with that, runs on a 3-year cycle. We're currently in year 2 and have 5 district grantees across the state. New applications for that will come out in spring 2025. And who knows what we'll get next year. This year we actually got less than 350 for the upcoming grant cycle. So I'm crossing my fingers that we get a little bit more, because the next piece, the ARP, Education of Homeless Children and Youth, is coming to a close. And this was our pandemic funding. So part of the American Rescue Plan, students experiencing homelessness receive their own pot of money. New Hampshire actually received just over $2 million as a piece of that. And so we were able to give that out to districts in 2 parts. One was a competitive grant, which again, a very small amount of districts applied for. I only have, I think it's the same number, 5 for that. And then the other was a formula grant, and that was a bigger piece of the pot. And we were able to get that out to a lot of districts who don't normally have that McKinney-Vento funding. And it's very flexible funding for students experiencing homelessness, transportation, supplies, wraparound support. We've had districts come together with community outreach. Identification of students was big for this pot of funding. And part of it, the state was allowed a set aside. And so we set up contracts with community organizations already placed for wraparound services for these students. So Waypoint, Granite YMCA, Families in Transition, and then we've been working with the Youth Success Project very closely with this funding. And I'm sad to see it ending. And I really do hope that, in the future, we see something like this come through, because once it ends, we just go back to our very small McKinney-Vento grant. I'm not going to read these. I just wanted to put them in so people are aware. The list of the job responsibilities for the local liaisons, so those district liaisons, is quite large. Biggest one is identifying students in need and students who would fall under the McKinney-Vento eligibility. So providing parents or guardians support, making sure that students are receiving the services they need, working with early education programs. Like I said, I'm just going to go through these really quickly. Making public notice. Part of what we're doing, we post information about McKinney-Vento out in the community. So districts do have posters and information in shelters and food banks and churches and any community organization, libraries, where families might see it and be able to understand what could be available to them if they are in the McKinney-Vento situation. And then the unaccompanied youth, just making sure that they have a voice in their academics, giving them an opportunity to receive their services, and making sure that they are able to fill out the FAFSA, receive that support if they choose to move on with their education, and they can help them file their status as independent students through that document. Okay, so I threw in some state level data. So one of the things, if you look at 2018, 2019, we had about 4,000 students experiencing homelessness, and then through COVID, it dropped about 1,000 students. This was because students went home. We weren't able to communicate with them through their guidance counselors, social workers, and find them as easily. And also people moved around quite a bit during COVID. 2022, 2023 is my most recent data. The numbers are starting to climb again, and I expect and I hope 23, 24 is higher, because we know that there are definitely students experiencing homelessness in New Hampshire at higher numbers than what is being counted in the schools. And the goal of McKinney-Vento and the goal of our liaisons is to find the students so that they can receive the services they need to actually have success in their educational career. If you look at the pie chart at the bottom, that is where we find most of the students, what their housing looks like. Our huge percentage is doubled up. That is where we find most of our students. Hotel, motel, unsheltered, and shelter are traditional and transitional housing in there. The unsheltered concerns me quite a bit. That number is fairly high for what we've seen. And then the hotel motel is actually also a growing piece for New Hampshire. Then I kind of put in our special education overlaps with McKinney-Vento quite a bit. So those numbers are almost half of what we see. And then unaccompanied youth and English language learners have a good piece of our population as well. So that's all the information I have, kind of a quick overview, nice little, here's McKinney-Vento, here's the definition, here's some of the things we're doing. My next slide, and I'll share this, Melissa, I haven't sent you this yet, but I will share it with you. A lot of resources out there if you want to learn more about McKinney-Vento.
Christina, I think what stood out to me was the number of unaccompanied youth that you showed, because we're not capturing that number. So there's a disconnect somehow, and that, just kind of putting it out there for the whole group to consider. That's an opportunity for us to work better with our school districts to make sure all of those families who are, who have the youth in school experiencing unsheltered homelessness, or even the youth themselves, have information about our projects. And we're not going to solve that today, but I think that's something worth pursuing in the very near future, especially as we're coming up on summer. So we're going to lose touch with a lot of these youth very, very soon. But perhaps we can get a plan in place for next year so that we have some better connections across our schools. Will, I saw you had your hand up.
Good morning. Just a question about the numbers for homeless youth. And, when we hear about homeless numbers, we always hear about the point in time count numbers, but rarely do we hear about homeless youth in K-12. And it almost seems that the numbers are treated differently. Is there a reason why that is so, why the numbers are treated differently, and why we only talk about point in time count most of the time? Because I've always been making the argument that our homeless numbers are way larger than just point in time count. And rarely do we talk about homeless youth in K-12. Just curiosity.
So Christina, maybe we can both take a shot at this. I think from my perspective, the conversation is happening, perhaps just in different settings than you're in, Will, because I'm part of quite a few meetings where we do talk about these numbers pretty regularly. And so maybe we just need to do a better job of presenting that information to this larger group. But also, Christina, I have one last thought, and then if you, I will stop talking. I think connecting to your local McKinney-Vento liaison in the school district in Portsmouth and surrounding communities will help you get your more local numbers.
Yeah. Yeah, I think it's spaces where we're talking about this is not overlapping right now. And so this is why this is really important that I'm here at this meeting. We're getting this information out here. And I'm on other things with Melissa too. And I also think it's that doubled up number that HUD doesn't recognize that is the large part. You know, those are families that are displaced. They don't have another place to go. They are, you know, through McKinney-Vento eyes, homeless. But we don't see it at HUD. We're not allowed to count that in that point in time count. And those are the numbers that get publicized because they're at that national level. So we are definitely trying to bring it further in the conversation. And I appreciate everyone listening today.
I'd say,
Thank
like,
you.
when we did our Council on Housing Stability data, we had multiple sources of data that we used, including these McKinney-Vento numbers. So we have the many years worth of numbers to show the trend, and then we put in some narratives to help explain the ups and downs and why things might change. Several hands are up. Operations manager. I'm not sure who that is.
I am Jeff from 100 Nights.
Hey, Jeff.
So the question I have is, individuals that are homeschooled, do they still qualify for any McKinney-Vento services?
So that gets a little tricky. McKinney-Vento is tied to public schooling. So schools do not have the requirement to reach out to students who are homeschooled to offer services. Some homeschool students do come into the building, right, for, you know, special or something like that. And then when at that touch point, we can kind of step in and help a little bit. But other than that, if they are homeschooled and have removed themselves from the district, they're not counted in the McKinney-Vento piece.
Thanks, Christina. And
Thank you.
Megan, you have your hand up.
I'm just gonna echo basically what you just said. There is a definition difference, like HUD dictates the definition for the COCs, and it is quite different than what the McKinney-Vento schools have. It's that doubled up number where that is not in the point in time. It is not considered literally homeless. It is considered housed. So just going that, that's a big and the point in time is very important for HUD COC funding, and that's probably why you hear that more in the COC than the other than talking about some other things.
And I wanted to actually go back to what Melissa just said about contacting your local liaison. I do have a list of current liaisons on the NHED website that's specifically my webpage. So if you scroll down at the bottom of it, there's contacts for the current year. If you want to reach out, it is kind of a ever-changing position. There's a lot of turnover there, but most of those are current and available. And if you can't get a hold of them, let me know and we'll get you the name. But I would encourage you to reach out to that person and just say who you are and kind of what you do and how, you know, maybe there's a connection that can be made.
And Mandy, I just saw your comment in the chat about in your grant reporting and applications, you supplement PIT data with your own data, DOE numbers, and the youth count that the Youth Success Project does. Talking is hard. So I think that's a really important point about, you know, each piece of data is a tongue twister. Each piece of data is one part of the story. So we have to put it all together to show what we can. Any other questions for Christina or comments? Thoughts? No? So I will share Christina's slides and the link to the website when I send it out. Susan, I see you waving at the camera. Do you have a question?
Yes, I do actually. If we have a family here at the shelter whose child is already going to Dover schools, already being provided transportation to that school because it's not our school, and she was homeless before she came here, and we move her into our transitional housing, which would put her yet again in a different school district, can that child still attend the school in the same district, but outside of that neighborhood? And would
Yeah,
McKinney-Vento
so that's
pay?
part of what,
Okay.
yeah,
Okay.
that's part of what McKinney-Vento does, is offer that stability. So especially for
Okay.
students who are moving around like that,
Yeah.
Dover will, just let them know the communication is key,
Yep.
and
Yep.
they will work to help provide transportation.
All right.
Yep.
Perfect. Perfect. Thank you.
Okay. I don't see any other questions in the chat. Any other comments or questions for Christina? No? Okay. So your presentation actually kind of flows nicely into our next part, which is, I wasn't planning on diving into these numbers too intensely because I don't have all of the breakdowns, but we do have our preliminary point in time count breakdown by county. And I'm going to show you 23 and 24 just because that's what I have open and kind of neatly totaled. Let me just share that screen. Just as a sort of a checkpoint for where we're at. And I think once we're at the point where I can work with Megan a little bit, because I just thought of this morning, Megan, so I haven't even asked you to help me do this yet. Going at some point in the near future, or maybe at a future meeting, we can kind of do the breakdown showing the different populations that are represented in the pit. I'm not sure that we can do that part by county, but I don't know, stay tuned. We'll see what we can figure out. But we do have our numbers. I think the biggest thing, and actually, I should have shown 22 as well, but I didn't. So I don't have it broken down with the total. The biggest thing I wanted to highlight is, first of all, the dramatic increase in unsheltered this year. I call it dramatic. It seems pretty significant to me. It's over 200 and it's 200 and I'm doing math real quick on the spot. 241, I think. Somebody check that. I think it's 241 newly identified unsheltered individuals. And speaking to what Christina had said, these are just the ones who have been identified. We know that our point in time count is not perfect. We know that we don't capture everyone for a variety of reasons. But I will say the communities really rallied this year and came together for a much more robust point in time count. And it's reflected in the numbers. And some of the most dramatic differences, I'd say Belknap County had a pretty significant difference. Carroll County, Hillsborough, and Merrimack. Those were the ones I really wanted to highlight. Rockingham and Stratford. So many counties did a much more robust count this year. And it's trying to carefully say it because politics are very strange right now. There is a lot of attention on unsheltered homelessness right now. And I don't know how we're going to necessarily navigate the next coming months with a lot of focus on encampments and our numbers so much higher than before. And Freeman, I see your hand. Give me half a second and then I will pause so you can jump in here. The one other point I just wanted to note was our sheltered numbers look like they've gone down significantly. The big difference, and I have it noted here, is our 2023 numbers included, it was like 600 and I forget, I'll have to find the exact number. It was a really large number of individuals, of households that were staying in a hotel paid for by the New Hampshire Emergency Rental Assistance Program. So in a hotel paid for with government funds, that counted as sheltered homelessness. And we did have those programs entering into HMIS and getting connected with coordinated entry. So our 2023 numbers while it was accurate that those folks were there, it was a bit of an anomaly. So we're closer to our baseline for sheltered than we have been before. I think it's slightly higher, but we also had our cold weather shelters this year again. Freeman, do you want me to keep sharing my screen while you ask your question or comment, or do you want me to stop so we can see each other?
It was just more sharing sentiment
Okay.
than anything. I mean, the numbers are the numbers, right? And the pit count shows one thing, but like Christine and I were talking about the disheartening news that like the balance of state coordinated entry, like prioritization list went up by like 300 bodies, you know, like, and we're talking like month over month, right? So I think some of this is due to to your point, more robust efforts to collect data during the point in time count. Um, you know, Ashina was in charge of the Belknap County team. I coordinated overall and helped with the Merrimack County team. I definitely think we had a more robust pit count this year than we have in previous years. We had even a QR code that participants could scan and they could do self-reporting. So I think that increasing people's access through technology is one of the reasons we saw numbers spike, but it's no uh, secret that last year in June, all the people that were in hotels due to ERAP hit the streets, and some of them managed to cultivate enough sympathy to get a couch for a number of months. But after Christmas and people start getting those credit card bills, it's like, all right, Christmas is over, get out. And we saw a real increase um, in that February to now time period of this year. And I think we're really just starting to see what happens to you when you yank all that federal assistance for those uh, hoteling abilities or temporary housing, whatever we want to call it. Um, so, you know, and there is indeed no one to go, and the encampment sweeps have been really picking up pace. I mean, just in Concord alone, it's literally every week there are two of them that we are being asked to address. And in Laconia, to your point about it being political, it got real political real fast and is getting real ugly real fast. And there is just nowhere for Ashina and I to put these people. Nowhere. So, you know, we either need to provide shelter or we're going to see tents on Main Street. Like there's no ifs, ands, or buts about it. Um,
I'm hearing that same sort of sentiment across the entire state. I'm seeing Matt Bucci nod. I know he and I have had many conversations about Manchester. I've been down doing outreach in Manchester with DHHS leadership. And I think, I don't know, I don't want to get myself in trouble and say things, but I am nervous about how it's going to play out. Because you're right, there's just not enough beds for people. Kind of connected to this, just want to put it on the radar that I know many of you were involved with Senate Bill 406 that was trying to add additional funding to the shelters in order to help support them and keep doors open and provide, you know, the all of the case management and housing navigation services. A few weeks ago, it was voted down in the House. It goes, I'm getting updates like left and right today. It goes back to the House Finance today where it's expected to be voted down again. But I did just get notice of a late item that was added to the fiscal committee agenda for Friday, trying to do the exact same thing. I will include that link when I send out all of the information showing what we're asking for. This is not a promise that the funding is coming. It's another sort of like last ditch attempt to get the funding that we were hoping for. I don't know how it's going to go, but that's happening on Friday. So hopefully we'll know by the end of the week if there are additional dollars coming through to support our shelter. So I will make sure to send that out as well. Any other comments or thoughts on the point in time numbers? Seeing none. Our next agenda item is NOFO is coming soon in quotes because we don't know what that means in HUD world, but it does seem, Mandy, I'm not going to comment on your comment, but yes, I see it. And now I've been distracted. Let me go back to my agenda. The Christy Schott and I have been sort of anticipating that the NOFO, the HUD annual competition for folks who are unfamiliar with the term NOFO, we anticipate that it's coming soon. Everything's sort of happening in the same pattern that has happened in the last few years. So we expect that it will be released sometime around 4th of July. That typically is when it has been coming out. I'm usually camping and Christy will text me and say, NOFO dropped, and I get to read it on the beach. And then it's usually due at the end of September. So I wanted to give Christy a chance to just share some ideas, share some reminders so you can start thinking about possible projects so that you're not scrambling once it is released. So Christy, I'll give you a couple minutes to talk through some NOFO ideas.
So first of all, for all of you who have grants with us through the Continuum of Care or YHCP and your renewal grant, we will be looking at pulling down your annual performance reports very, very soon for scoring purposes. So we will be sending out those annual performance reports, having you take a look at them and correct any data in HMIS prior to us using any of that information. We typically give you a couple of weeks to clean up that data. We do anticipate the 2024 NOFO coming out soon. I think we shared last time, maybe not, but the NOFO is moving to every 2 years, which is phenomenal. We don't know what next year will look like as of yet. HUD has shared that they're still working out this process, but there will be an opportunity for agencies to potentially, if they need to reallocate or do something new with a project, there might be that opportunity. So we will look forward to that next year. Balance of State does have, I'm hosting a bidders conference next Wednesday, the 22nd. For anyone who is interested in applying for any potential new or bonus funding through the 2024 NOFO. This is open to renewal projects as well who may want to expand their projects or any new projects that you can think of that you might want to apply for. So I highly encourage you to come to our meeting next Wednesday. I will put my email in the chat. I did send it out to everybody, but just in case, I can forward that off to you. And that's all I got.
Christy, I got distracted by somebody telling me that their child keeps calling me mama when they see me on the screen. So I apologize. But did you mention the focus on housing and healthcare leveraging? Can you touch base on that real quick?
Yes. So in the last, I believe, 2 NOFOs, HUD has really focused on leveraging healthcare resources and leveraging housing resources. With healthcare, they are looking for partnerships between continuum of care projects and healthcare agencies in your area. A lot of your agencies already do this and already have those partnerships with healthcare. They're also looking at partnerships with housing authorities and other housing resources to kind of have some other funding that's available to the COC projects for people to be able to continue to reside in permanent housing. So one of the big things is looking at, can you do a partnership with your local housing provider or New Hampshire Housing Finance Authority? Well, they'll assist with the rental assistance portion, and your agency would assist with the supportive services sides of things. Typically, HUD is looking for us to, with any new project, to see if they are able to leverage either healthcare or housing resources. Freeman, they are not acknowledging renewal grants at this time, even though most of you already work with healthcare providers across the board. They're really looking at those new projects to have those partnerships with either healthcare or housing authorities. or other housing options. Thank you, trying, Freeman.
The only other thing I want to mention is that Christy and I have been tossing around some ideas that we'll bring to the executive committee next month and then bring to this group when the NOPO does open, about ways to use our data a little bit more to provide either like bonus points or incentives for projects to apply. Looking at a couple of things we've tossed around is like areas with the highest amount of homelessness. So again, like maybe using our point in time numbers just to show like this county had the highest, this one had the next highest. And none of this is like set in stone. It's just ideas that we've been tossing around because HUD has also indicated that we should be using our data to do needs assessments and things. So that was one part we were looking at. And the other part we wanted to look at was by county, how many permanent supportive housing beds, how many rapid rehousing beds do we have currently, and where are the gaps between like the numbers of homelessness and the numbers of beds available, and finding a way to prioritize those. If people have ideas or thoughts that might work, send us an email and let us know, because we want to find a way to really get the projects in the areas that they're needed.
HUD also asks us every single year if we're doing gap analysis of our continuum of care and our service coverage areas. And just like for one example, we only have one permanent supportive housing project in Eastern Rockingham, and it serves about 14 people. So really, we're looking at to have some data-driven decisions about where we have those gaps in our system and what we can do about them.
Any thoughts or questions on that? And again, I know we just sort of threw all this sort of information at you, so feel free to think about it, send us ideas. You can attend Christy's session. I think you said it's next week, to hear more about what we're expecting. Last year, we did get all 6 bonus projects that the COC applied for. Freeman, I see you. Hold on half a second. Our COC did get all 6 bonus projects. And some of those bonus projects are actually helping us at BHS build up our collaborative applicant staff to help continue doing the work that HUD has been asking us to do. So one of those positions will really be doing project-focused like system performance work and tracking their APRs and tracking their outcomes and helping strategize how to improve different items that HUD actually scores us on. And then we'll be adding a position that will be dedicated to COC grant management. So some of the more concrete tasks like the monitoring and the contract stuff will go to a different person. So Christy can really spend all of her time doing some of the COC system work that continues to improve our score that helps us get these new projects. So I think as a COC, we're in a really good position as far as new projects go. So our annual renewal demand is around 7.7 million this year. And typically the bonus projects are what, 5%, Christy? I think it's about 5% of our annual renewal demand. So there is the potential, I'm doing math while we talk, of bonus funding of about 385,000. We won't have the exact number until the NOFO actually comes out, but it's a decent amount of money for a decent sized project if you'd like to start thinking about what you might want to do with that. So we just wanted to give everybody a chance to start brainstorming before that like 90-day window of the NOFO hits, and we don't want it to be frantic. And Freeman, I saw your hand. I almost forgot to.
Yeah, it was just when we talk about gaps, you know, and unsheltered homeless being such an issue of optics, right? You know, because the folks that that we're always talking about, the you know, let's call them the 1%ers, right? You know, the people that are maybe associated with some of the symptoms of poverty and these undesirable behaviors that are a result. that top percentage of the unsheltered population that maybe there's a lot of publicly visible behaviors associated with would really benefit from something that was low barrier to no barrier, like palletShelter.com. And I'm just wondering if there are, and if not, why there are not efforts to like NOFOs specifically for things like the Pallet Shelter Initiative, because it's a FEMA solution that was deployed during Hurricane Katrina, and we have nearby examples in New England that are touting great success. People stay for an average of 6 to 12 months and then move on to permanent housing, and it gives them their dignity back, and it gives us our main streets back. So from an optics standpoint, this is good for everybody. This satisfies business owners, which, let's face it, money talks. And even if you want to remove all the humanity from this issue and appeal to people's selfish natures, this is a good way to do that. Because the people that maybe, I'll come out and say it, hate poor people, hate homeless people, hate people that maybe use substances. If you can give them a meaningful way to sweep the streets, so to speak, rather than the really expensive thing we're doing right now, which is playing whack-a-mole with human beings. I just wonder why, when we've got such a deployable solution, when you can have 26 people off the street or 30 people off the street in a matter of 3 days, provided the money's there, because that's how long it takes a pallet shelter village to set up, is 3 days. I just wonder why we're not going full steam ahead at solutions like this that are scalable.
So I have a couple thoughts, and then I'll pause and let others chime in. I would say HUD made an attempt with SNOFO, that supplemental NOFO, to focus on unsheltered. We got 2 projects, which was better than nothing, but it wasn't for that purpose. HUD has also said they're focusing on unsheltered homelessness coming up. I don't know what that's going to mean. But one thing I'll say is last budget cycle, so state budget, I don't know what my state fiscal years are. So last time we went and did the budget, our bureau put in a request for $10 million per state fiscal year for shelter purposes. And the hope was to better support the existing shelters and then have opportunities for adding some non-congregate solutions, because that is also part of the NOFO, is what are you doing about non-congregate sheltering, which is exactly what these pallet shelters would be considered. So we did request 10 million per state fiscal year, and we got 4. So I would say in the next budget cycle, which we're starting to prepare for, if you see requests from the state for increased shelter funding, call and write whoever you can to support that request. Because the only way we're going to get the resources we need is if people show up and advocate for it. And I can't do the advocating, I can do the requesting and the justifying with the data. But if everybody else shows up banging down those doors, maybe we can make some progress. Any other questions or thoughts on that?
Hey, Melissa, it's Gary.
Hey, Gary.
With regards to the statement that you just made, for myself, I longstanding, and a lot of folks have heard, I don't know what I don't know. And for the funding that you're talking about, not the HUD funding, but the state run funding, is there the possibility to create perhaps a central distribution that notifies the COC that X, Y, and Z bill is coming? If you want to support it, here's who you reach out to? It
exists. Go to the Housing Action New Hampshire website and get signed up for their alerts.
Thank you.
You're welcome. That's a great point, because I don't know that everybody knows about that. Housing Action New Hampshire tracks, they're the advocacy body in New Hampshire, and they track all of the legislation. And they are generally the ones who will do sort of like call to action, letters needed or testifying, people are needed to testify. If you can't find it, I can connect you with the right person to get you on that list.
Thank you so much. I appreciate it.
You're welcome. Okay, anyone else? This is a quick meeting this week, or month. I don't know what we're doing anymore. The only other item I have is that the every seat on our executive committee is up for renewal this year. So I have a survey already created. I'm going to drop it in the chat. We will be seeking nominations for every single position. I wrote it the survey that's coming out tells you what the positions are, and it talks about the specific responsibilities for the executive committee. Over the past 2 years, we did a lot of work cleaning up our governance charter so it was clear what the executive committee role was. Prior to that, I think it was really vague and unclear, really kind of frustrating and hard to understand. So we bulleted out, and I will send all of this to all of you to look at. The specific responsibilities, how frequently we meet, how we vote, and I'll just send it all to you instead of trying to read it to you. But in general, it's 6 times a year. We meet every other month opposite the COC meetings. We may have to adjust the time because my director changed our management team meetings to directly conflict with everything COC schedule. So we will, once we have a new group, we will set that recurring meeting. But the responsibilities really fall within how to plan and use the COC funds. I want to see how I wrote it. So the decisions and recommendations for COC funding purposes have to be made within the HUD Continuum of Care rules and regulations. So if we're voting on priorities for the NOFO, we can't say, well, our priority is going to be something that HUD doesn't fund. We have to make sure we're prioritizing it in the way that HUD will actually approve. So we provide direction and recommendations for the planning process. So those things we were bouncing around about, do we want to score based on the PIT? Do we want to score based on gaps? That was one of the things that the executive committee will make a formal recommendation on. The second one is to make all formal recommendations requiring a vote to the COC, make recommendations for goals and strategies to prevent and end homelessness within the balance of state service area, and approve all corrective action plans that result from the COC annual performance monitoring, which Christy had mentioned earlier in this meeting. So those are the 4 responsibilities of the executive committee. Sometimes our meetings really are just getting together to chat about what's going on and see if there are topics we want to learn more about. And then a couple of times a year, we have specific things that we must act on. And we have, I lost the list. 1, 4, 5, 6. There are 8 positions that we will be seeking nominations for. The committee or the term runs for 2 years. You are able to serve consecutive years. You are also able to nominate yourself. I do ask that if you nominate another person, that they know that you're nominating them and it's not a surprise. Please make sure that they're aware they're being nominated, and that they are okay with being on the ballot. I would hate to have somebody nominated on a ballot who's really either unwilling or unable to serve in that position. I will set the dates. I didn't get that far before our meeting of like how long the ballot will be open, but I will send it out today. And generally we give about a week for nominations, and then the vote will happen in June. I'll send out a survey, an electronic survey with all of the nominees in each position. I'm trying to find the chat again so I can send. It's not a pretty link, but the link will bring you to the page with the nominations. I will also send it in an email to all of you. So you don't have to try and save it today and make a decision today, but it is in there. And Freeman, thank you very much for putting in the Housing Action New Hampshire link. And Lynn, I see, was it Lynn's comment? Laconia moving forward with the Pellet Village. Okay, so there's more Pellet information. There's a lot
Yeah.
happening in the chat that I missed. So cool. You
Yeah,
guys are making
sorry.
connections, and that's great. No, that's good.
The context is that the mayor's task force, which I'm on with my director Beth, is pushing forward. They've applied for some leftover ARPA funding, and we're waiting for the official answer back. But being the opportunist that I am, this is a scalable solution and grow or die and all those sentiments. So why not scale up?
Yep.
You know, I would love to see more than just one pallet shelter because we've got quite an issue in my hometown, which I'm not a service provider there, but it's gross to watch it go down. Having lived there most of my life, and Concord isn't getting any better, it's getting worse. And we're just, like I said, playing whack-a-mole with people and they're dying.
Not excellent that that's happening, but excellent point. We have time if anybody would like to share any updates about what's happening in your community or your agency. I'll give it a moment to see if anyone has anything they'd like to share.
Hey, Melissa, this is Gary again.
Hey, Gary.
I'm not able to access the link you shared.
Okay. I am having technology challenges.
Fair enough,
So
not even a worry.
I will have to figure that out when we're not in this meeting, and I will just resend
Fair
it by
enough.
email. I'm sorry.
Fair enough. Thank you. No, it's all right. There are worse things in the world.
Oh, goodness. All right. Any other? Oh, Christy's waving at me.
Of course I have something. The coordinated entry subcommittee will be sending out, hopefully very soon, a survey for participants who are either currently in coordinated entry or who have gone through the coordinated entry process. And I will send out more information in that email, but we're looking to get our annual feedback from participants so that we can continue to improve that system. We are also working on developing a survey for housing providers, so you'll see that in the next coming weeks as well.
All right. Oh, Heidi's got her hand up. Go ahead, Heidi.
Just the youth subcommittee, we met yesterday, and many of the work groups are doing all kinds of work. The Rural Youth Homeless Outreach Work Group is meeting with several providers that are working on a training series around rural youth homelessness. They'd like to spread across the state. They're working on that. The Training Standards Work Group is meeting to put together documents following the great work that was done with the outreach curriculum and adding a layer of trainings that might be pertinent to youth on top of that. And then the driver's ed and licensing work group is working with the Department of Motor Vehicles and lots of other community and state organizations around looking at scholarships for driver's ed for folks, looking at where a car is available for people to take their driver's test, paying for any of the fees for these things. There is a they're rolling out a mobile van through the Department of Motor Vehicles, which they're still ramping up, being able to travel to help people get their documents. They have a list of folks they're going to be starting with, but they're trying to get the van teched out. I'm not sure how to say that right, but so that can go to other places. They are also looking at Big Brothers, Big Sisters to develop a mentorship program around working with youth to help them get their driving hours in. And AAA as a possible partner, and the Automobile Association as well. And there is a single point of contact work group that is continuing to meet. They are working with the colleges and universities around, similar to what a McKinney-Vento does in the K through 12 schools, something also to happen in the colleges and universities. And I did just get an email about some potential national legislation on that as well. So stay tuned for that. And then the youth count work group is being morphed into a group that might be able to do the youth lens for our point in time count for January. And there's a bunch of work going on with that, where they are also putting together the data from the 2022 youth count that was done and a research project with Plymouth State University. So stay tuned for the information from that as well. So that's a ton of work, and they're continuing to meet. And yeah, that's what's happening with the youth subcommittee.
Thank you.
Just real quick, I'm participating in Over the Edge this year. Anybody that wants to see me jump off a building, feel free to contribute to that. All the proceeds are going to our mobile food pantry. Our mobile food pantry is entirely funded by donations. So Jameson, who is part of our team, drives around the CAP mobile food pantry van through both counties. He serves elderly, shut-ins, as well as our unsheltered friends and neighbors. So it's not just people experiencing homelessness, it is many who are experiencing food insecurity. And we are currently, we have a second van, but we don't have the money to fund it. And that will be another van for food insecurity, and mobile outreach is our goal. So anybody that can help contribute to that Give Smart United Way link, anybody that's not familiar with what Over the Edge really is, you can rappel off of the Brady Sullivan Tower, which is the tallest building in this part of the country before you hit Canada. So north of Boston, it's the largest building. I've raised money for it for a couple of years. I've actually never hit my goal to be able to rappel, but my director was able to do it the year before last. She hit her goal. But again, all the money goes to our mobile food pantry, really important cause. So thanks. Yeah, I think that's all of it.
Thanks, Freeman. All right, last chance for any updates, and then you all get almost an hour back. Seeing none.
I do.
Mandy, go ahead.
Yeah.
I just saw your hand go up right at the.
Thank you. Last
Yes.
minute. I just wanted to share with this community of providers that Waypoint is now providing youth navigation supports to young people throughout the entire state of New Hampshire. And we have a very targeted and specific focus on the North Country, so Merrimack County North. And if you'd like a mailer or any marketing pamphlets that we have, feel free to send an email to me and we'll get those mailed out. But the idea is for us to connect with young adults throughout the state. We're able to provide brief hoteling in order to bridge them into safety. We have Uber Health, so we're able to transport young people toward safety. And I hope that we're able to meaningfully connect with young people, particularly in points north of Merrimack County that need low barrier support, and it's available 24 hours a day, 7 days a week, 365 days a year. So happy to connect with anyone north of Merrimack County, particularly to begin building bridges and start those really important relationships. Thank you.
Thank you, Mandy. I was going to say that as well. I'm going to have Melissa share with all of you the updated regional access point listing, which includes all the contact information for Waypoint and all of our other regional access points with the notes.
And one last thing that I will share in the email is I have been getting a lot of emails about our the 1959 supportive housing benefit, the Medicaid benefit. I'm going to try and put some easier to follow information in the email for everyone, because there seemed to be a lot of questions and confusion about what the benefit can actually cover. It really is truly tied to permanent supportive housing. It's the services side of permanent supportive housing. This isn't something that can supplement the shelter work. It doesn't supplement outreach work. It really is connected to the housing part of it. And I know that we have needs in all of the other areas as well. Please know I know that every area is under-resourced. There are a lot of things coming through DHHS that are Medicaid benefits that will cover some of those other gaps as well. Not for shelter necessarily, but for a lot of the different services. So I'm going to send some information out about that. If you are a permanent supportive housing provider who would like to be able to bill Medicaid for the services side, you do need to enroll as a Medicaid provider, even if you already bill Medicaid for other things. You must enroll specifically to provide this benefit. And we are frantically working here to put together documents that show the flow of the work. CMS, which is, the Medicaid federal agency, I can't remember the acronym, Center for Medicaid and Medicare, I think, services, has continued to throw us kind of little, just little hurdles we have to clear. And we are still on track to be able to start billing for this July 1st. I do not expect this to roll out like a freight train on July 1st. I think it will be slower. Because we are still trying to figure out exactly how it will work. But if you are not a permanent supportive housing provider, you don't have to pay attention to this part. So I know a lot of people have so much on their plate. They're trying to interpret every single thing we send. If you are not a permanent supportive housing provider, please feel free to just delete this information. And then once I send out the more simplified information, if you still have questions, let me know, and we can work together on setting up a session for the folks who intend to enroll as Medicaid providers to provide this service. We didn't want to do a full-blown training for everyone because I didn't want to waste people's time if this was something that you weren't going to be able to provide or needed to know. I know how tight everyone's time is. So just stay tuned for more information about that. And Gary, I see your hand. Oh, and Mandy was first. Or was that your old?
I'm sorry, that was my old hand. I'll take it down.
Oh, you got it. All right, Gary.
So my question is, being the regional access point for Eastern Rockingham, I think, and please correct me if I'm wrong, Sandy's organization at Crossroads offers permanent supportive housing. So with me being the regional access point, there was talk about like referrals and information being funneled. Am I still a part of that, or can I be excused from the table, please?
That was a good question. And no, you can't be excused. I'm sorry. So there are two parts to it. So most of it is open to anyone providing permanent supportive housing. One of the components of this whole process is that regional access point work. If your agency does not want to bill Medicaid, you don't have to. You do still have to do your regional access point work. You just can't bill Medicaid to be reimbursed for it. So it really is covering what you're already doing. It's just giving you another funding stream to pull from to build up the work.
Got you. So, and I apologize because it's something that I only just learned about recently, so I'm still trying to wrap my head around it. If Crossroads elects to bill Medicaid, then how would I be involved in that? Or if it needs to be a separate offline conversation because I'm out lost in the woods, I'm happy to do that as well.
Okay. So I'll give sort of a high level answer for everyone because I'm sure other people have this question too. The flow of the work is not going to change whatsoever. So I guess I shouldn't say that because there is care coordination coming, but stay tuned for that. We'll have a specific presentation about that. DHHS is really trying to streamline efforts so that we aren't having to make referrals in 10,000 different places. We have more of a centralized case conferencing kind of platform we can use. But don't worry about that part either because that's not here yet. For 1915I purposes, the coordinated entry flow really is going to stay pretty much the same. The part that people need to worry about is and you don't have to worry about how Crossroads is paying for it, but each agency, it really is more about, is this funding coming from HUD or am I billing Medicaid for this? It really is more about who's paying for that particular service. The flow of the work really won't change. So your role in the regional access point, you'll still take those calls. You'll do the initial coordinated entry assessment, follow the policies and procedures we have, make your referrals. And then the receiving agency, if they are billing Medicaid, then they'll bill Medicaid for their services. If they're not, they'll pay for it some other way.
Okay.
Okay. And Owen, did I see your hand come up?
Yes, hello.
Hello.
Thank you for presenting the data earlier broken down by the counties on homelessness for 2023 to 2024. 2024 numbers I've actually been looking for, very interesting. Do we have those numbers broken down by COC currently?
Yes, I can. Megan, you can probably help me get that. Or you
Yeah, I
did give
sent
me that.
I sent each COC their point in time data.
Okay, I don't seem to have it. If I could have that sent over to me, that would be fantastic.
I know
It's Meg Shea. We're presenting on it tomorrow, in our meeting on Thursday.
Ooh, okay, got you. All right, I'll touch base then. Thank you, guys.
Excellent. Okay. And hold on, I don't know if this chat is from this meeting or something else. So Sandy's question, Sandy, I will respond. I saw your email. There have been fires left and right here this week, and I just haven't had a chance. I'm sorry. The immediate crisis is almost resolved, and I can get back to this hopefully this afternoon. So I will respond to your email. And I will put some information in my email as well. Okay. All right. With that, I think we can wrap it up for the day. You get 43 minutes back, sorry. And I really appreciate everyone. I will send all of the notes that I have when Christina sends me her presentation. I'll make sure to add that to my email. And then I will send the link to where all of our meeting recordings go so you can keep a reference to it. We add our trainings there, we add our COC meetings there, and it gets updated every time we add one of these. So, all right. Well, thank you, everyone. I appreciate you all. Have a great day.
Take care, y'all. Bye.
Thank you. Bye.
Bye, everyone.